Hey, this is Jeremy, and today we're going to be talking about working with other agencies. So this is going to include the fire department, law enforcement, hospitals, even just the Department of Transportation in general. So everybody that we work with, or that we're going to come in contact with in the professional environment, they have a role and they have a purpose, just like we have a role and we have a purpose. And at the end of the day, our purpose as EMS providers, as these EMS professionals, our purpose is to get somebody to the hospital. And at the end of the day, that's it. Okay, we are not providing definitive care. We are providing emergency, life-saving care to get somebody to that definitive care. And the way that we all work together is going to help our patients actually make it to that definitive care. So, for example, let's say that we respond to a car wreck on the interstate. Well, there's a couple of different agencies that are going to be involved with that. First, the emergency medical dispatchers that are going to actually be providing information for the call, providing information to you, providing information to the bystanders, or maybe even the person that's actually injured themselves. The police are going to show up. They're typically going to be doing the accident investigation. And that doesn't have a direct impact on patient care, but it does allow us to have an understanding of the mechanism of injury, how the impacts may have occurred, if it's not immediately obvious. And the police, they're also going to be able to help control any irate bystanders, or just kind of keeping the scene safe. And they can actually help you with some patient care, such as rolling a patient, or maybe helping you get a backboard up a hill or something. They can help, all right. But again, you have to respect them just like they're going to respect you. The fire department's going to be the same way. The fire department, they can help you maintain that scene safety through having the numbers there. They can help you with the patient care, such as they're typically going to be the ones that are going to be in charge of extrication of that patient from their vehicle. On the ambulance, we don't carry tools to extricate somebody from a vehicle. We have a backboard and we have life-saving equipment for the patient themselves, not for the environment around them. The fire department, they can also have the special rescue teams, such as the high-angle rescue. They may have people with ropes. They may bring out the ladder truck for high-rise situations, or maybe use it as a pulley system. There's lots of different ways that they can use their equipment, they utilize their equipment, because that's what they train for. That's their job. And if we understand that, we understand our roles together, again, we're just going to be helping the patient, right? And the Department of Transportation, so DOT, you may have a unit that comes out there and helps control traffic with the assistance of PD. They can help you help keep it safe by providing the flares, the safety cones. There's lots of different things, and we're all working together. Now, we may transport somebody to the ER to the nurse there, right, and to the physicians there once we get them into the back of our ambulance. Now, the firefighters, they may be able to ride with us, police may ride with us. It's all dependent on the situation, what type of resources that we have, and what resources we're kind of be leaving on the scene. Now, whenever we make it to the ER, we're getting into the continuity of care. So I'm not the end-all be-all. Us as paramedics and as EMTs, we're not the end-all be-all when it comes to this. So we get them to the hospital, we get them to the emergency department. And the emergency department, they provide additional stabilizing care. They have the ability to do x-rays, MRIs, CTs for strokes or head injuries. They can do that spinal clearance. If you have to intubate somebody, they have further ways to identify that and to control somebody's airway, such as with paralytics and sedatives. And they can confirm tube placement with x-rays, which is absolutely phenomenal. Their ventilators are significantly better than just a BVM, that what a lot of EMS providers actually, that's all they have on their truck. And the ventilators that they have at the hospital, they're going to be significantly better than the ventilators that we have in our trucks. So, us getting them there to that ER is going to help propel them to possibly getting up to surgery, where, again, they're moving physicians, they're moving nurses. Okay, and the things that we do in the field are going to directly impact them for the rest of their care. So we do need to paint an adequate picture to the people that we give report to. That way, whenever they give report to whoever it is they need to, they're getting our story from the field. It's going to be taken down in the notes. Now, they may be going up to surgery where they're going to be taking a stay at the ICU. They may get out of the ICU to go to med surg, and once they're in med surg, they may leave there to go to a physical therapy place. There's lots of different providers that go into these types of environments. We take somebody to the hospital, and the ER is not the only part of the hospital. The ICU is not the only part of the hospital. There's lots of different people, lots of different resources that get utilized in these types of situations. Now, you may end up into a situation where you're at a place where community paramedicine is a thing. And if that's the case, you may have paramedics who are specifically trained within an area, and they're going to go out to these places where you may have an elderly patient, or a patient who's a frequent flyer. What can we do to minimize them from calling the ambulance, from going to the ER and taking up those other additional resources, while also increasing their quality of life? Are they a fall risk? Do they fall a lot? Well, do they fall because the floorboards are creaky, or they don't have floor mats that are taped down? They slip on their floor mat, then that's an issue. That's a fall risk. If you tape down the undersides of the floor mats for them, that'll help. You can go out to their house and ensure that they have adequate lighting. That way they can read their medications. Or maybe the husband and wife, they've gotten their medications mixed up some, so they're not taking the proper ones. You can make sure that, hey, your medications are here, your medications are here, and help ensure that your patients that you're going to with this community paramedicine are actually going to be, they're knowledgeable about their ailments and the things that they can do to better themselves and better their lifestyle. And you may get called out as a regular 911 truck to these community paramedics who are on scene with a patient who may be sick. So we need to understand that, again, we're all a system. There's lots of different facets to this than just what's on the surface. And if you can think of this as a whole picture, you will have a better understanding, and you'll understand the scope of practice, understand what everybody does, what their role does, and how they're going to further help your patients. And it's going to do nothing, having this understanding is going to do nothing but help you as a provider, help further your career, and at the end of the day, help our patients, which is really the big thing that we're after. And that's going to be the big things about working with other agencies.